And thanks everyone for participating. I'm just going to share my screen. Hopefully that'll work. Let's see, here we are. And let me know, you know what, I need to go to full, the layout.
If you go to slideshow, next to animations, I believe that would work.
To the right. To the right.
On the right, okay.
Not all
Oh,
the
in
way
the middle.
Just one more to the left.
Yeah,
there,
up.
right there, a little bit.
Slideshow.
Okay. Oh no. Camera. Sorry. Here.
That's okay. Take your time.
Now here we go. And just from the beginning, right?
That looks perfect. Yep.
Okay. You guys see it?
Magic. It worked.
Excellent.
Great.
Excellent. Sorry about the little technical snafu. So yes, the problem throughout this entire crisis, going back really to January of last year, is that there's been an assumption in many circles, I would say the mainstream media as well, that there is a trade-off between public health and the economy. Now, I'm an economist, so as an economist, I do study trade-offs, right? Within economics, we do that all the time. There certainly are trade-offs within economics that one studies. However, when it comes to public health and the economy, my argument has been really from the outset that the two are intertwined, particularly when it comes to something like a pandemic. And that has to do indeed with the interdependence across economies, within economies, from region to region, et cetera. So that's going to be my main argument. And just as a backgrounder, I'm a health economist. I've got more than 2 decades of experience in this field. My focus is healthcare policy, drug and diagnostic, as well as device pricing and reimbursement. So for example, with COVID, I've analyzed testing, I've analyzed treatments, I've analyzed pricing and reimbursement of vaccines, et cetera. I'm not a macroeconomist, just so you all know, that's a caveat. But as a trained economist and someone with a long-term interest in public health, I do understand how public health and the economy relate. And so again, you can't have sustained economic recovery, some call it structural or sustained in a long-term steady state, if you will, without controlling the coronavirus. The responses to the pandemic really, again, for the last year, have often been framed in terms of striking a balance between protecting people's health and protecting the economy. But is this assumption, if you will, of a trade-off, is it true? Well, a preliminary way of answering the question is to simply look at some of the macro data, okay, from how economies that have controlled the virus, how they've done, versus how economies that have not controlled the virus, how they've done. And if you look at the worst possible data from last year, Q2, we really see evidence for there not being a trade-off between public health and the economy. Now, this is somewhat dated in that it's Q2 of last year, so 2020, but I've seen recent analyses at a macro level which suggests that this particular ranking, if you will, has held up pretty well. And look at the top, the far to the right-hand corner of the diagram. Look at Taiwan, South Korea, Finland, nations that have done very well in terms of their controlling of the coronavirus. Again, through different means. Some have had lockdowns, others haven't. Others have done contact tracing and extensive testing, et cetera. But they've done a very good job at managing the virus, and their economies have not shrunk that much. In the case of Taiwan, really, they didn't have a recession at all. And South Korea didn't have much of a recession. In fact, South Korea might have grown in 2020, Taiwan as well. And if we look down the list, see who's really performing very poorly. You see the UK at the bottom and Spain as well. And that has held up since last year. In fact, if you look at the data now, the UK has suffered a dramatic decrease in GDP of over 10%, Italy as well, Spain, etc. And those nations did not and still do not perform well in terms of controlling the coronavirus. So just a glance at some very recent data, and they're still compiling 2020 data, by the way, so this might be revised in the next few months. That's just the way it is with these calculations. But a good estimate at this time is that Korea had less than 1% contraction, really didn't go into recession, recession being defined as 2 consecutive quarters of negative growth. Taiwan, as mentioned, New Zealand did fairly well. It did contract by around 5%. As we know, it's done very well in controlling the coronavirus, but it did less poorly, much less poorly economically than, say, countries like Italy and the UK. Now, if you look in the United States at some of the states that have done poorly and some states that have not done so well. Vermont, though recently has not done as well in the last couple of months, but certainly throughout 2020 had a fairly commendable record on coronavirus. It also has very similar unemployment numbers to those seen in North and South Dakota. Okay, yet you can see again, very, very different in terms of their COVID-19 response, in terms of case numbers, hospitalizations, as well as deaths. And the IMF is forecasting, still forecasting roughly 4.6% decline in the US. And you compare that to China's GDP that actually grew in 2020. We know what China did early on. Clearly, they had some contraction early on, but they did implement a severe lockdown and were successful at controlling the virus. And you look at their growth that's forecast for 2021, and it stands out as being perhaps the highest among the industrialized nations at 8. Now, again, I'm not going to comment here on what did and didn't happen in China with respect to the early reports on the virus. That has been rehashed, and I think it's important for that to be revisited. But what I'm trying to show here is they controlled the virus and have an economic recovery that is sustained moving forward. We look at the early numbers, and it is very early. Right now, what is it, January 28th? But we look at the US, unemployment rages on. The job losses are significant across most sectors, from manufacturing to services. Sure, some people have done well, like Amazon and some other groups, and certainly many professionals have done pretty well, but many have not. And so I've argued that if the US is, quote unquote, competing with China, we know that Trump has said this, Biden says this, well, it's certainly failing. It's failing on both public health and the economy. Of course, many factors affect the COVID-19 death rate, right? So there are factors that each nation has, whether it's underlying health conditions such as obesity and diabetes, et cetera. And the shocks to the economy, they go well beyond the policy decision. Some have argued that it's the policy of lockdown that produced the shock to the economy. Well, sure, the lockdowns themselves, they contribute initially to a contraction in the economy for sure, but it's really the virus that is trying to be controlled by policymakers. And without that control, you would have not only a haphazard situation in which you wouldn't know which end is up, if you will, you'd also have terrible, crushing, not only losses of life, but also health system capacity constraints. And so this is something that needs to be accounted for. We also don't know the full impacts of the pandemic, long COVID. We don't even know with some of the asymptomatic people, the cases of people who have not really gotten sick, but we still don't know the impact of the disease on them. It's still a young virus. We do not, however, see any evidence of a trade-off between protecting people's health, COVID-19 response, if you will, and protecting the economy. And I acknowledge that in protecting people's health with COVID-19, it may be the case that certain aspects of public health in the non-COVID-19 related realm, certain aspects, they don't get ignored necessarily, but are set aside. That is true. We see that in healthcare, for example, but that's a response of the healthcare system, a capacity response. An ICU unit in Boston at Mass General in April of this year, and even recently, has to make room for these patients, the COVID-19 patients. Therefore, non-COVID-19 health related concerns, surgeries, elective services, etc., they get set aside. And I'm not saying that's a good thing. I think that's a bad thing, but people often argue that somehow it's the lockdown or the policies that have caused that. Well, no, it's a response to the healthcare system to there being so many patients with COVID-19. Okay. And I am heartened by the Federal Reserve Chairman Powell saying just a couple of weeks ago, it's not the economy or public health. So he's acknowledging here that there isn't a trade-off. And way back in March, I argued, not that I was prophetic at all, and many argued something similar, but I just want to mention the fact that, I argued that there was no trade-off, that they're intertwined. And this was around the time that Trump had referenced the need for America's economy to be up and running again. It was almost as soon as there was a implementation of guidelines and social distancing, literally within 3 days, he said, we have to be up and running again. We cannot let the cure be worse than the problem itself. We've heard that before. We heard that from Trump. We've actually heard it from many governors in the United States. But what Trump's pronouncement and many others have echoed since, Charlie Baker last week, he said something very similar. He didn't say it the same way that Trump did, but he said something very similar. They appear to imply that there's this trade-off rather than an interdependency. So Baker, for example, will say, well, we have to open up now. We have to open up. And yeah, it's maybe not so great in terms of public health, but we just have to do that. We have to make sure the small businesses are back on their feet, which is understandable, right? From a very short-term perspective, certainly understandable. But it ignores the interdependency of the economy and public health. So undoubtedly, the US economy experienced a substantial exogenous shock, and this went around the world. Severely curtailed economic activity. It temporarily put many out of work. And again, Baker's response, even Trump's response, I understand the gut response. You want to revert to normalcy as soon as possible. No one wants to see businesses suffer. No one does. But the challenge really is to achieve three main objectives. Two of them are simultaneous. The third objective can only be achieved after the first two have been accomplished. The first thing is effectively combating the coronavirus. And there are methods, which I'm not an expert in, but there are methods with which we can do that. I think we're using some of the methods and tools, and this applies to many nations, but I don't think we're using all the tools at our disposal. And at the same time, there needs to be provision of substantial financial support to the millions of displaced workers, small businesses, et cetera. The ones that Charlie Baker's talking about. He's the governor in Massachusetts. The ones that Trump talked about for many months. And the ones that Joe Biden talks about. Certainly understandable that these people are hurting and we need to help them. There needs to be a mechanism with which they can survive as going concerns. And then third, it's important to restart the economy, not in a stop-start fashion, which really has occurred in France, the Netherlands, the UK, US, wherever there's been kind of a failed policy, we see this stop, start, stop. We see it now in California, in Southern California, well, really across the entire state. I think we've seen some of this in Massachusetts. I don't think that's a great idea. I really don't. I think you need to restart the economy, obviously, carefully. You need to do it across all sectors, but to do it in a bumpy fashion, in a haphazard fashion, in a disorganized fashion, I think that really puts the entire public health objective at risk. With that, I conclude my talk, and I'm open for questions.
Thanks, Josh. We have a couple of questions in the chat, and I think Blake had the first one, and I think it's a good one. Blake Elias asks, he says, we're supposed to be a capitalist, money-hungry society in the U.S. Why do you think we've not applied this here during the pandemic and done the best thing economically?
Yeah. It's a good question. It needs to be broken down into a few parts. I actually, let's start with what's the most recent tool out there, right? Vaccines. So there are ways of distributing vaccines, not just distributing, but actually administering them to people's arms in ways that are consistent with capitalism, quote unquote, or a more capitalist approach. And I think West Virginia and a number of other states have done this. They've effectively contracted with pharmacies, your CVS's, Rite Aids, et cetera. And they're doing a fairly good job of vaccination as a result. So certainly there are some aspects within this COVID-19 response in which you can utilize to the best way possible. You can utilize certain, again, quote unquote, capitalist solutions. Some of the solutions offered in terms of vaccines are not capitalist. They're simply, many are state sponsored, open up the convention centers, administer shots, in that kind of way, almost like a factory floor in a convention center. And I think those are very useful as well. But there are some ways in which we can adopt capitalist measures. In terms of, but I think maybe the question was not so much on vaccines from the person who posed the question, but maybe how we respond, right, to the pandemic, how we as policymakers respond. And I do think you see that countries that are wedded to this capitalist, maybe not ideology, but certainly this free enterprise capitalist system, which again has many positive advantages, but they're the ones who are saying, well, we need more liberty. We need to be individually, we need to have our liberty so we can make money as a small business, as a restaurant, as an enterprise. And clearly in face-to-face contact enterprises, right? Like small businesses, like gyms, like people doing physical therapy, that sort of thing. Yeah, clearly it's important to be able to do that in order to make money, right? So maybe the argument has been from those who are pro-free market, well, we got to open up the economy because that's the way we can effectively make money. I think that's very short-term oriented. And what do I mean by that? Well, look what's happened in Texas. Look what's happened in Southern California, even in Massachusetts to a degree. The stop, start, stop policy that I just described has been deployed in part because they wanted to open up. They wanted people to be able to make money, right, in a capitalist way. In a way, I understand that, but they had to stop. They had to stop because they saw the cases rising. They saw the hospitalizations rising. They saw the healthcare system capacity unable to cope. And then they stopped, and now they want to restart it again. And again, in a haphazard fashion, because the businesses are clamoring for, understandable, they're clamoring to survive. So I think that at least in a number of instances, New Zealand being one, Australia is kind of an outsider. They have a conservative government, very much a free enterprise government, but they have managed this not so much in a capitalist way. New Zealand does have more of a managed economy. I would say Finland is in that group, Taiwan certainly, China, of course. And Korea. Looking at the successful countries, I would even include Japan in that list. I know they've had far more cases than, say, Taiwan, but they've done a whole lot better than the US. I think countries where there is that management ethos, it's not against capitalism per se, but having some kind of management and being obedient to those policies, they've been more successful because they haven't, their knee-jerk response has not been, we need to make profit, we need to make profit, we need to survive, we need to do this and that. The government has stepped in and said, look, we'll allow you to survive, a supported lockdown or supported measures, whatever, but we need to get through this now. We need to control the virus before we can have a sustained and healthy economic recovery. So I know that's a long-winded answer to the question, but hopefully I've addressed some of the points that the person wanted me to answer.
That's a good answer. There's another question from Greta Fox, and she's asking, how can we influence local government, for example, the Baker administration?
Yes. Well, in my own very marginal, small way, and of course, many of us have done this, and there are some who've contributed in a massive way, like Yaneer, by writing about it, by talking about it, by writing op-eds, by hopefully, getting someone in the administration, whether it's a governor's administration or president's administration, to listen to a different set of policies. I think that's obviously the best way moving forward. I do think that Baker at times has listened. I think in recent months, he hasn't as much, and I'm not exactly sure why. Perhaps he's been influenced a lot by the the various lobby groups, restaurants and small businesses. And in a democracy, of course, you're going to have this tugging, right? This tension, if you will. You're going to have people pushing the governor in multiple ways, and often not the consistent way we'd like. But actually, I think in the case of Baker, in the case of maybe even Gavin Newsom, certainly in the case of Phil Scott in Vermont, Hogan in Maryland, people who are accustomed to data, to reading data and evidence, right, on healthcare, I do think they can be influenced by that data, right? Baker worked in healthcare. He worked in it for a long time. He was part of an insurance company, but still. So data is really important. And for example, by showing Baker what will happen likely, when we reopen the various things that he's reopening this week, if this new variant takes hold, et cetera, or variants, multiple variants, I think that's the best way, because I do think ultimately the sane governors, if I can say that, the sane governors listen to data. They listen to evidence. I think there's some governors who are hopeless cases, and some politicians overseas who are hopeless cases, who will not listen to data, no matter how bad the data is. I think South Dakota Kristi Noem is one. Again, I don't want to disparage anyone personally, but I do think she just does not listen to anything. But that said, I think there are plenty of governors and politicians and leaders who do. Look at the UK. Boris Johnson is a great example of someone who didn't listen at all in the first month, and he got sick. He got very sick. And although he's had an incomplete, haphazard response, he certainly has listened more to the data since April than he did before. So it even had an impression on him, and he was a skeptic for so long. The Netherlands, where I lived for many years, Rutte, who is their prime minister, he was a skeptic at first. He has begun to listen to the data. So they're not going to listen to an emotional response, but they are going to listen to, objective data on the ground.
Sort of following up on the UK and Boris situation, when that happened, like when he actually got sick and became hospitalized, and then sort of afterwards, what were you expecting to sort of happen after that? Were you expecting a sort of whole like countrywide shift in strategy?
Yes, well, It's very complicated to answer in a minute or two. I've actually read a lot about Boris Johnson over the years. My daughter lives in London, and so I follow the politics there, not just of Boris Johnson, but many politicians. And it's a very interesting case. It's not easy to decipher. I did expect once Boris Johnson got very sick, and then when he came back into the public's view, and you remember he was wearing masks even after he had been through this. So he was clearly being very careful. I think he was cognizant of not only the fact that he became very sick, but he saw that, the NHS was overburdened. So I think he sort of changed during that period. Although again, he then, like many politicians, he's not the only one, he straddled the fence between going all out, right, and crushing the virus, as could have happened in the summer. It could have happened across Europe. In the UK and Europe, they had very low numbers and they could have crushed it. They didn't. They decided not to. He decided not to as well. Spain decided not to. They all decided not to. And I didn't expect that. I did think that once those numbers came down in May and early June, you recall, you were really seeing some very low numbers. And that was the point at which action, in fact, action within a few weeks, action could have actually obliterated or at least reduced the cases to very, very minimal numbers. And it didn't happen. That surprised me more than anything else, because I do think he saw the severity and the seriousness of it all. I even think some of his government ministers did. But for some reason, and again, maybe it's that, getting back to the first question on capitalism, this idea of, oh my goodness, if we have another shutdown this summer, even for a few weeks, we're going to stop tourism and all this stuff. Because I remember reading a lot about tourism, Spain especially. They needed tourists, they needed tourists, they needed tourists. So they opened up. And you saw that across all of Europe, including the UK. And it was very painful to watch because they had been successful initially at certainly crushing the curve. I would say they'd been pretty successful, but then they didn't follow up. And that's what surprised me. You see, in the US, we never were that successful. We plateaued. People forget, we plateaued at around 20,000 cases a day, which seems like a little right now, but it really was a lot back then because we weren't testing that much. We plateaued at 20 and we were content with that. Lord knows why. But I think it would have been much harder in the US to crush it than it was at that time in Europe. So yeah, getting back to your question, I think what surprised me was no follow-up, no follow-through. And I think they really could have followed through in June and crushed the virus, gotten their economy back as well, because this has not been good for the British economy. Talk about stop, start, stop policies. My goodness. It's just not been good at all. And now with Brexit on top of that, which is another shock to the system, you get these complicating factors and and you get pandemic fatigue, right? I think you get more pandemic fatigue by having haphazard policies, right? Stop and go policies, than you would having what Yaneer has argued for way back in January and February, a 3 to 5 week strict lockdown, and followed by a reopening in green zones. I think you'd have a much less of the pandemic fatigue than you have now, because now people see it as, oh, we're going into lockdown again, even if they're not really going into lockdown, but certain restrictions. And then they open up again. Oh, 2 weeks later, we're going into lockdown. That, personally, I have to say, that exhausts me. And I'm in favor of the restrictions, but it exhausts me. So I can only imagine how much it exhausts others. Whereas having early on, having an effective, I hate to use the expression Wuhan lockdown, but quite frankly, what they did, I realize it's not something that probably could have happened here, but they effectively crushed it. You saw that, right? They crushed it in about 7 weeks, I would say 6 to 7 weeks. They really crushed it. And had we done something even somewhat similar, like New Zealand did in Auckland and Wellington and throughout the country, we wouldn't be having this conversation. We wouldn't even have this conference. We would be in a much, much better situation. But alas, we're not.
Thanks again, Josh. There's been a lot of activity and questions in the chat, which is always a good indicator for an interesting talk. So we're about out of time, but thanks again for coming. It's a very good talk.
Sure. Thanks a lot.
Yep. Okay, so next up we have Irene Peterson. Irene is a professor of epidemiology and health informatics at University College London. Today she'll be telling us a little bit about rapid tests and sort of thinking about whether or not we can test our way out of COVID. So Irene, welcome. It's nice to have you.
Thank you so much. I'm really delighted to be here. And just to follow up on Joshua's last comments about the way they have handled COVID pandemic in London, I had hoped that we were able to get it out of the country over the summer, but unfortunately they decided to do the opposite. So you may have heard about how the finance minister launched a campaign that said, what was it? Go out, no, I forgot the slogan, but the key point was that they wanted to go get people out to all the restaurants and go out and eat. And then the government would pay for half of the bill if they went out. And a lot of people think that was actually what started the pandemic off again in September. So no, I think there are a few of us who are very impressed by the way that the UK government in general has handled the pandemic. But I will continue. Oh, that's the last one. I will just get to the first one here. So my question is, can we test us out of the SARS-CoV-2 pandemic? And today I'm gonna first take a look back about what happened or what has happened in the last year. And then I'm going to look at some of the tools we have in our toolbox. And then I'm going to talk a little bit about symptom testing. And then finally, I will talk about population testing. So a year ago, can I get a hand up and see how many of you would have known about, known all these words I've listed here? Are there any who can say yes? Okay, I can see one person. Yeah, I think for many of us, we have got a lot of new words in our vocabulary during the last year. It has been a different year. In many ways, you can say that the arrival of the coronavirus has changed our life. And I just took a screenshot from the official government website in UK from today. And you can see we are about 66 million people living in UK, and 380,839 people have been admitted with COVID. And today we had 3,000 people. We still have nearly 4,000 on ventilations. The situation is still dire in most of the country. In many parts, we have the support from the army. You have pictures a few weeks ago of ambulances outside the hospitals waiting for hours just to offload the ambulance. It's been a pretty scary time in the last couple of months, especially here in January. Also because you suddenly realize that we no longer have a healthcare system. So if you fall and break your leg, you are not in a good situation. And if we look at the deaths, it's also not looking very good. We passed the 100,000 milestone a few days ago, or actually in early January. So, and you can see just this week, nearly 8,000 people have died. And we have a definition about whether you have died within 28 days of a positive test, or there's another definition whether you have COVID on the death certificates. I think both these definitions are probably underestimating the number of people who have died with COVID. But this gives you an impression, so you can clearly see here we had the first wave in March, April, May, and then as Joshua mentioned, it was very, very low over the summer, and then it started to pick up. And in November, we had the second lockdown for a month, and we just came out of that. And at the same time, we had the new variant arriving, and that is resulting in this new peak, which is just about to go down again, and that is after we have had a lockdown for about 3 weeks now. So that's where we are in UK at the moment. And to try to understand what is 100,000 people or dead people, it's very difficult because it's a big number. So I've tried to think about it in terms of double-decker buses. And we have about, or you can fill about 120 passengers per bus. So until today, we have managed to fill 863 buses. And if we put all these buses in one long row, it would be more than 16 kilometers. It's a long row. And there is still a long way to go. Last week, it was estimated that 1 in 8 have had COVID in UK. So you can also turn it around and say 7 in 8 haven't had it yet. So when we started having COVID in UK, the UK government and their advisors were talking about herd immunity. If you ask them today, many of them will probably not admit it, but that was the case. But I'm glad that they realized that was not the course to take. So the question is, where do we go from now? And which tools do we have? So we can make restrictions on human interactions, and that's what we have just covered. And we know that lockdowns, they do work. We have seen it. You're able to reduce the numbers because you simply restrict the human interactions. And there are various degrees of lockdown. So we have the stay home, we have some people out, we have sometimes school closures, we have shops, pubs, restaurants closed. So there are different ways to restrict the human interaction, and also different degrees to how much you restrict it. And then we have on individual level where we are encouraged to keep a certain distance apart. I always found that terminology, social distancing, is a strange term. It should be called physical distancing instead, but never mind. Then we have the face mask, which restrict make restrictions on the transmission. And then we have test, track, and isolate. And finally, there is a chance that vaccine may also help to reduce the transmission. We still don't know the exact degree or whether they will reduce the transmission. So we know that most tools work, but the pandemic is still here. So we need to start thinking in different terms. So we know that the vaccine is likely to reduce the mortality fairly soon because it is primarily the older part of the population who are dying, but still it won't completely reduce the mortality. And also, as I mentioned, we don't know whether it will reduce the transmission. But I think what I am, or have known for some time, but also I think we are realizing is that we cannot rely on the vaccine alone to end the pandemic. We have to get the numbers down, also because if we have a high number of people who are infected, we have a much higher risk of mutations. So it is important that we get the number of infected people down as soon as possible. So what can be done? Yes, we can do a very, very hard lockdown, and that effectively, we could end the pandemic that way. What they seem to be doing in UK and in many other places is that we continue to yo-yo in and out of lockdowns. And the other thing where we could reduce the numbers of infected would be to improve our test, track, and isolate element of the management of the pandemic. So in UK, and I guess in most countries, the testing system have been based on a typical way of testing when you have a infectious disease. So you focus on testing individuals with symptoms, then you track their contacts down, and then you get people to isolate in the period where they are infectious. But there's a number of problems with this system. And the first problem is that if you only test people with symptoms, you are missing quite a big part of the population. So I published a study in October, which was based on data from the Office for National Statistics COVID household survey. I was looking at these data for another reason, and then I came across some data where they have asked people whether they had symptoms on the day that they were tested. And I should also say that this survey is based on a random sample, so it is representative of the UK population. And what we found was only 14% had the core symptoms on the day they tested positive. So it was a cough, a fever, or loss of smell and taste. And only 23% had any symptoms on the day of the test. So if we call this the symptom test, it's a really, really poor sensitivity you have of that. There are, in other words, 86% who have no core symptoms, or 3/4 do not have any symptoms. This was a cross-sectional study, so we could not tell whether somebody would develop a symptom later. And there are other studies which suggest that some people will eventually develop symptoms, but about 30% never develop symptoms. So that is a major gap in the test, track, and isolate program. The other problem is that many people who are tested positive do not provide their contacts for various reasons. And often the contacts are made too late. So by the time you get to the contacts, they may already have been infectious and infected others. And finally, we have the problem of isolation, that some people do not have the opportunity to take 2 weeks off work, and many people don't have adequate space to isolate. So we have another tool, and that is population mass testing. And in many ways, it's very, very simple, because the point is really that if all your friends, your family, your colleagues are tested on a regular basis, then there won't be many places for the coronavirus to hide. And in some way, it's just extremely simple. And it is surprising that we haven't used that tool further yet. But I think it is something that we will see being a very crucial part in the future management of in terms of trying to get out of this pandemic. So how would this work? I think there are 3 things we need to make sure for this to work. So first is that we need cheap, reliable, and fast tests. So the problem with the PCR testing is that we don't have capacity to do mass testing, so test millions of people per day, and it's expensive, and it takes a long time before you get an answer. The other thing we need to do is we need to test on regular basis, and we still don't know exactly how often, but there are indications from modeling studies that if we test twice a week, that will be enough to capture most people when they are infectious. And then, as with our current testing system, we still need to identify and isolate infectious individuals. So do we have cheap tests? Yes, we do. So we have what we are calling the rapid antigen test, or in UK, we call them the lateral flow test. And women or couples who have tried to become pregnant, they may be familiar with this type of test because it is very similar. You take a swab in your nose, and some of them are also in your throat, and then you dilute it, and you put a little bit of the dilution into the little hole here. And then within a very short time period, you would get a result where it would tell you if you are positive or if you are negative. So the next question, are these tests reliable? And that's where there have been some debates in the last months, probably a little longer. And that is because people have compared lateral flow test or rapid antigen test to PCR test. But it's important to realize that the PCR tests are different from the rapid antigen test. PCR test is based on identifying RNA, but it captures both current and past infectious people. So if you test positive on a PCR test, you may have a current infection, but you still test positive for quite a while after you are no longer infectious. And it varies from person to person. But I mean, I've had several emails from people who have explained how they were ill, they tested positive, and then 3 weeks, 4 weeks later, they had another PCR test. One had to travel to India and had to have a test before she traveled, and it came out positive again. So there is a long slope where you are still testing positive with the PCR test without being infectious. So when you then compare the rapid antigen test to the PCR test, then it looks as the lateral flow test or rapid antigen test have a low sensitivity. But what's happening is that the rapid antigen test, they test on the actual virus material, and it captures the vast majority when you are still infectious, so the live virus. So I think it's important to realize that when you see studies saying, oh, there is a very low sensitivity with the rapid antigen test, it's because we are making the comparison to the PCR test. The other thing is that we have, and that's the name, the rapid antigen test is because they are rapid, and you get an answer within 30 minutes. Whereas the PCR test, you often have to wait 24 hours or up to 72 hours before you get an answer. So I think we do have the tool available, but there's still some way to go before we are gonna get to a place where we can do population mass testing. It is underway in UK. So the government has now started a pilot program in large companies where they are testing employees twice a week. They also set up a number of test centers around the country where you can walk in from the street and have a test, or you can book an appointment and get tested without having symptoms. One of the big challenges is, of course, to get people to engage in the testing programs. And there is an issue again that many people may not be able to or cannot afford to isolate and be off work for 2 weeks or 10 days. And therefore they are avoiding getting tested. And that is a serious issue that needs to be resolved. The other issue is the logistic of testing. Is there a test center near where you live? If you're testing in schools, how are you going to set it up? Who's going to take the test? Are they good enough at doing it? And what do you do between you have the test and you get the test result? And finally, there is the question still about how do you isolate? And can you afford to isolate? Again, I think these are all challenges that can be overcome. And I also think that it is not a question about that each bit needs to be 100%. Even if you can imagine that we test a group of 1,000 people and we have identified let's say 3% who are positive, even if half of these people isolate, it's much better than none of these people are tested and none of them isolate. And it can be quite effective if you're thinking about it at population level, that you will soon get all the infectious people out of circulation. And this way we will reduce the transmission substantially within a short period of time without having a major impact on our daily life. I will stop here and ask or take questions or comments.
Thank you, Irene. We have a few questions in the chat, and I'm wondering if I could start.
Yeah.
I wonder, do you know of any countries that are sort of utilizing these rapid antigen tests very well? And if so, like, how are they doing it and what are the outcomes?
Yeah, so I mean, we are still at the early stages. So I know that in Slovakia, they did it over 2 weekends, and they really tested very aggressively. And it did bring the numbers down. And I'm also aware that they are going to do another round of mass testing. So that is probably one of the biggest large-scale rapid testing. But what we are seeing in many European countries now is that first people were hesitant, and I think it was very much because of these poor validation studies. So it got a very bad reputation. But I think that more and more countries are realizing it is actually a tool that could be used very well and could help us, especially to capture the asymptomatics. So in UK, they did a pilot study in Liverpool, but now it is being rolled out in more and more places, and the ambition is to have, I think, 2 million test capacity a day in April. So they are moving fast forward.
That'll be interesting to see how that goes. There was one quick question in the chat about the price of a typical rapid antigen test, and maybe you can tell us also about the price of a typical PCR test.
I actually don't know, but I have seen prices on the internet, and I mean, I think it's horrendous. You pay, I don't know how many dollars in the US, and the same in UK if you want to buy them, like 5 in a box. But if you think about the cost to produce them, they're not that expensive. So it is a question about scale. And in UK, if you go to a test center, you don't pay. And some employers may pay for the test, but also the government provide test. So if you look at the raw cost, the rapid tests are much cheaper than the PCR test.
Thanks, Irene. So I think we're just about out of time. There were a lot of questions in the chat that I didn't get to, but thank you again for coming, and also thank you for sort of putting together this talk so last minute. This conference was essentially this whole conference was like a big last minute rush. So it's really nice to see. We got tons of really great speakers, and yeah, thanks to you and thanks to all of the speakers for doing everything so last minute. It's been really nice.
No, thank you very much. It's a pleasure, and yeah, I will hang around. So if time after, I'm happy to chat about it and go into further details.
Great. Thank you again, Irene. Okay. To give some closing remarks for the conference, we have Yaneer. Yaneer is really the guy who is sort of responsible for most of this. I mean, he started End Coronavirus, and let's see, he started that in maybe February or March. I forget which one. And by now, I think you're probably involved in like a dozen COVID groups, like all sorts of zero COVID things. Yeah, I think you're the perfect person to sort of close us out.
So unfortunately, let me say, I'm not responsible. It's the virus that is responsible for what's going on. And I think the important thing is that this conference is not a normal conference, of course. This conference is a working conference. It's a conference that is engaged really in the issue of how do we advance our ability to address this challenge. I've been involved, of course, in many conferences where there's a tremendous opportunity to think about and discuss issues. In this context, we are, of course, in a directed fashion, trying to think about what are the ways that we can cross-fertilize our understanding as members of a team that is engaged in a challenge together. And even if one says that normally the endeavor of science is that kind of endeavor, surely the time frame is very different. We are focused on a current problem. We would like it to be gone as soon as possible. And we are constantly aware that the suffering that is currently present around the world is driving our responsibility to make a difference. I want to thank all of the speakers who made tremendous contributions, and everyone is involved in high pace, very intense responsibility. I think they understood that this was an opportunity for them to share what they're doing and hopefully enhance everyone's actions. But particularly, I want to thank those who are engaged in the challenge of really changing the understanding more broadly, because we have seen through this conference that the science is essential, but the thing that makes the science essential is it is being communicated effectively to the public and to policymakers. And those people who are doing that communication are not necessarily scientists. They're not necessarily normally occupied in science communication, but they're working hard to help everyone understand what we can do in order to stop the outbreak. And then there are some who are, of course, involved in on-the-ground action, and we were very pleased to have them participate. Whether there was, of course, fantastic presentation from someone who manages his own nursing home or care facility. And there are people who are involved in government action and or government decision-making. And in some sense, many of us have been involved in government decision-making because we are building the communication that is in one way or another influencing those decisions. But the purpose of this conference primarily was to try to figure out better how we can organize everyone together. Right? This is a community action summit. How do we organize ourselves and the communities that we're connected to in order to make a difference? Because we all know that the action in this context and the success is a community responsibility. So again, thank you everyone. And of course, that's not just the speakers. I want to extend that to all the participants, because I'm quite sure that everyone who came and participated in this meeting, everyone who is interested at this level is almost by definition involved in communication to their family, their friends, and more generally their communities and beyond. I also, of course, we also owe a great thanks to those who were directly involved in the organization. Kim Severino, of course, did a major part of the work. Matthew Hardcastle, Katie, Derek, everyone who organized and the program and ran the program and made sure that it ran smoothly. I think the main, like with successful operations, when it goes well, people don't realize that there's a lot of work that is going into it. I was just part of a conference where they spent many, many hours clearly preparing for it, and it all fell apart when there were technological glitches. So I know that not every conference works successfully, and I think this one ran smoothly and effectively and provided lots of opportunity for people to interact with each other. As we bring this conference to a close, let us, recognize that we are again at some stage of this outbreak. There's a lot more to be done. I wish we could say that this was the end point, but of course it isn't. On the other hand, there is, as I mentioned early on, the beginning of change in the understanding and attitudes. And during this conference, we had a presentation by Michael Baker from New Zealand. Yes, last night there was published an article in, and I'm going to forget the name of the newspaper in the UK. Someone, what?
Guardian?
Guardian, yes. There's a Guardian paper he is a co-author of that lays out in very, very clear language the 16 reasons that they identified that elimination is the right strategy. I think that piece will have a large voice. I think we also see that in Germany, in Ireland in particular, we are watching a change in the public discourse and a change in the government conversation. And obviously those two should go together. Other countries are also shifting how they're responding, given the variants, given the new threats that are even undermining the existing unfortunate strategies even further. So there is some renewed hope that we will emerge from this through an elimination process sooner, hopefully, rather than later. But eventually, the teacher is the virus. The virus has been giving the world a severe and uncomfortable lesson, one that we wish we didn't have to go through. We are helping to anticipate the lessons that would be made in the future and trying to make them current so that the decisions can be anticipatory and not so reactive. And with that, again, I want to thank everybody. I think we are with renewed dedication. I think that there is an opportunity for everyone to share in this important responsibility and to bring others into this. And I hope that this conference, in some sense, will continue in the sense that we will continue to gather our understanding, to enrich the links between us so that we can be progressively more successful in defeating the coronavirus pandemic. Thank you very much. I know that there is an additional social session. I think that everyone can continue to participate. I think maybe you want to explain, Katie or Kim, what are the additional opportunities through this meeting, and of course the opportunities that anyone has to join the organizations that we are part of to continue to make as big a difference as we can together. Thank you.